get absorbed. It's these things called micelles. Now look at what it is. It's just a mixture of fat and bile, right? These are all, but this is the bile coating it here. There are some phospholipids, right? There are some glycerides, triglycerides, monoglycerides, diglycerides, right? There's some cholesterol in this fat droplet. So this is the fat droplet, small enough that we can absorb, and again called a micelle. It's just a combination of different kinds of fat. And the more fat you have in your diet, the more of those that you're going to have. So as you have these micelles, right, these are the ones that are going to be transported into the cells. Right? As the micelles come over here, reach the epithelial membrane, the fat part of the micelle is going to just absorb directly across the cell membrane because it's hydrophobic. It can go directly across the cell membrane. And then the bile salts are going to go get used again and keep forming these micelles to keep bringing them in. So the bile is going to stay out here, get recycled as we keep bringing these in. Once these fats are brought in, what is there inside of the cell but water? So as the fats come in, what are they going to do? They're going to coalesce again. And when the fats coalesce again back into little fat droplets in the cytoplasm, we call that a chylomicron. Now there are two structures that deal with fats in cells. There's smooth endoplasmic reticulum, and there's the Golgi. I mean, that's what one of the things they do, is just deal with the fat. Golgi is going to be used if we're going to take the fat and transport it out of the cell. Smooth ER is going to be used if we're going to take the fat and use it to make other fats for the cell, right? So the cells are always making different kind of hormones, things like that, or whatever, so they need a source of cholesterol especially, right, to do that. So smooth ER does lipid biosynthesis. I believe that would probably be a simple definition of what we say smooth ER does. What's its source of lipids to convert into other lipids? The lipids it absorbs here. Okay. If we're going to transport these to the blood, which most of it's going to do that, it's going to pass through the Golgi for extracellular transport, and ultimately be absorbed into lacteals. So these chylomicrons are going to pass through the cell and be absorbed into lacteals. Because of their size and chemistry, they're actually too big, for one thing. They can't come into the blood capillary. So this little fat droplet here of the chylomicron gets sucked into the lacteal. Now the lacteal then goes into intestinal trunks, chylocysterna, thoracic duct, and is going to get dumped into